segments. Hello and good evening, everyone. Welcome to Black Moms Can, Black Mom Society Community Town Hall, where we'll be discussing our maternal health care and healthcare. We are so excited to have you here with us. Tonight, we are so graciously welcomed by several panelists and our moderator, Mrs. Zephanie Smith Eisenstadt, who will be leading us in a discussion and a conversation across different industries, and also taking questions from you as our audience and as our guests. And we are so happy to have you here. So just to introduce everyone, just to introduce who I am Dr. Makita Green. I am the CEO and founder of Black Mom Society Incorporated. We are a women's group that focuses on the professional and empowerment of young Black moms across all levels, whether you are a new mom, prenatal, empty nester, you're in the middle, you are just where you're supposed to be at this moment, and all moms, whether you are a momty, a godmom, you are a mom of adopted children, it does not matter. You are a mom and we love you and we are here to support you and care for you just the same. And with that being said, we are going to start off with our why. At this moment, we are in a current election cycle, and we are so happy to have this conversation. This is a much needed conversation, a much necessary conversation, and we require that this is needed for our Black moms to feel empowered in our space. And as you can see within my son, he's also excited for this conversation too, if you don't hear him. And we are here today to talk about why this critical issue within maternal health and healthcare. Although this is not something that we see within our national election, we understand that maternal health care, topics around families and women are definitely critical and important within our local elections. And with that being said, we have to make sure that we understand the importance of it. We understand we understand our why, and we understand the necessary topics and information so that we make informed decisions about our leaders and our school boards and everything that's related to us within our communities. And our aim is to make sure that everyone has an impactful, comfortable insight, experience, and understanding of what we're doing here. So with that being said, we will start off with our panelists. We have Dr. Astral Webb, who is the CEO founder of Healthy Kinder International. She is a physician. She is also, I would dare say, one of my mentors, and she is going to be speaking to us about breastfeeding and the importance of having that information for our young moms. Our second panelist will be Mrs. Yannick Williams Adeniji. She is a licensed social worker serving at the current moment Virginia, New York, Maryland, and Washington, D.C. She is also the CEO founder of Full Joy Mental Health Care Practice, serving Maryland, Washington, D.C., New York, and also Virginia. She will be speaking to us today on the importance of maternal mental health, postpartum, and the fourth trimester. We also have Ms. Yasmin Lachman, who is serving as the current one of the current board members of DMV, District of Maryland, Virginia, St. Vincent Grenadines, Mutual Aid Relief, and she will be our public health expert focusing on a Gen Z conversation, speaking to our young moms and our young women on their health care and also reproductive justice. And we also have Mrs. Colette Cyrus Burnett, the CEO and founder of Global Food Warrior. She is our expert on everything related to food, agriculture, sustainable food, and what we are doing holistically to our bodies as we are preparing, as we are moms, women, and our families, and what we are putting in our systems, because that is also important to our healthcare as well. And then we have, certainly last but not least, we have our lovely moderator, Mrs. Stephanie Smith Eisenstadt. She is currently hailing to us from Hawaii, and she is our resident expert on public health expert on everything related to maternal health care and healthcare. And we will get started in a few minutes.
Well, aloha, everybody, and thank you so much for joining us. We're going to give Dr. Green Ediale an opportunity to, while we express our gratitude for this space, to make sure that all platforms are streaming. I see some feedback in the chat. If you're watching us now on YouTube or Facebook or Instagram, give us a little bit of a wave or a shout. Let us know that you can see us and hear us okay, and we'll wrap up and get started. Listen, thank you. I just want to start with gratitude to thank each and every one of you for joining us live on a Sunday night. We recognize that there are so many places and spaces vying for your attention, and we are ever so grateful. Whether you're joining us live this evening or tuning into the recording at a later date, that you have chosen to share this time and space with us to examine and to explore what Vice President Harris has identified as one of her top 3 priorities. And it matters that many of us on the call, whether we're on the panel or not, frankly, many of you who are watching this conversation as well, have dedicated our lives in response to our own lived experiences, the experiences of our mothers and daughters and sisters and neighbors and aunties and uncles and community members, whether a mother or not. We're all impacted by the motherhood journey. And so we're going to be getting into that. And even with the gravity of national and the global conversation, you'll hear tonight from practitioners and program providers and community frontline leaders, because ultimately this is where the rubber hits the road. So with that, I'm going to just pause for just a moment as we're getting some feedback that it's just you, Dr. Green Ediale, that's showing on the YouTube screen. So we want to make sure that everyone can hear and see our panelists. So even as I'm speaking, it's just showing your face. Is that something that, let me know if you want us to maybe pause and restart the recording before we bring up the panelists?
Yes, it looks like we may have to. I apologize. There is something. It was working before, now it's not.
Thanks so much, everyone, for bearing with us. We just want to make sure you can see and hear everyone before we bring up our esteemed panelists. So please bear with us for just a few more moments.
Okay, that should be good. Okay. Okay. I'm going to end the stream. I'm going to end the stream and then resend it again. Okay, Zephanie,
Yes.
I think I may need your help.
Okay. Simon is suggesting that we can all join the Zoom. Can we do that?
Um,
Are you on the Zoom and you're doing the Zoom to YouTube?
I am doing, yeah, that's what I was trying to do, but we can actually we can do that too.
Well, hold on. Let me think for a minute.
I'm sorry. I did all of this.
Let me just see. Are we still live on?
We are all the way live.
Oh, no, we're working. It's on now. It's on properly now, I believe. It
Okay.
looks like we're all on the YouTube now. You restarted the YouTube?
I did.
Okay.
Okay. So we're
It looks-
on YouTube. But the Zoom is the one that's the one.
Everything looks perfect on YouTube now, and it just started about 10 seconds ago.
Okay. Kira is saying she can only see one person. I am going to share sound. Okay. Let's see. There's a way.
If you are seeing us on one of the different platforms, just go ahead and give us the feedback.
Everyone, well,
seeing it on YouTube, but just one face.
You're seeing it on YouTube?
Yes, no background, just Dr. Green, and it seems to be now starting up from the very beginning.
Okay.
No, on YouTube for me, I can see all of us talking now. So if you reload it, it goes to all of us. So we're live right now on YouTube. And for those who are watching us on YouTube, what's happening is we want to make sure that our Zoom audience can see us as well. So if you would just bear with us, and then what we'll likely do once we get the Zoom sorted is we can restart the broadcast on YouTube so that we have a clean recording. So if you just go to Black Mom Society on YouTube and you go to the new live link, you'll see all of us there now. And then I'm not sure about the Zoom. I'm not in the Zoom room. Let's see.
I think we can see, I think Zoom is seeing us. Can you see us on Zoom? Can anyone tell me? We can see you now on Zoom. Yes. Fix it, Jesus. Okay.
Yes, we can see you now.
Thank
We
you.
see the live stream. If you could just make it bigger,
Got it. Okay.
then we will be able to see them.
Thank you.
Mhm.
All right.
Perfect.
Okay. Whew.
All right. So why don't we start?
Thank you, everyone.
Yeah. Do you want to refresh it and start from the top so we can have a clean recording, or we've got time?
Okay. So Zephanie, say that one more time.
Do you want to stop it and start it over again? And we'll just start from the top.
So that you mean stop sharing? No, we can just keep going, and then we'll do a we can do a mid check-in.
Okay, so why don't we start from the top then, so that it's on this same YouTube recording, because our previous introduction's on a separate, I believe it's on a separate YouTube link, because you had restarted, or if you want to just completely restart the recording, the broadcast, then fresh.
Okay, so I'll start over. Okay, thank you so much for coming. This is a reset. We are here. I am Dr. Makita J. Green Ediale. I am here, CEO, founder of Black Mom Society Incorporated, which is a women's group held to focus on the professionalism and empowerment of young Black moms. We are here to work with all moms, not just every mom. We are working with new moms, moms in between, moms of adopted children, all moms, empty nesters. We are here for you and we love you. Thank you so much for coming and joining us today. We have in the midst of us fabulous women that are here to discuss maternal health care and women's health care, as it is a critical point in our election cycle and just in our lives as well in this current in our current state. And we are led by Mrs. Zephanie Smith Eisenstadt, who is the trustee of the NAACP Foundation and also and a lecturer at the University of Hawaii, and also our public health expert on maternal health care and women's health care. And she will be leading our conversation today with our panelists, Dr. Astral Webb, the CEO founder of Healthy Kinder International, Yasmin Lachman, one of our current board members of District Maryland, Virginia, St. Vincent Grenadines Mutual Aid Relief Fund, Mrs. Colette Cyrus Burnett, founder and CEO of Global Food Warrior. In between that, we have my son, who is absolutely excited to be a part of this conversation too, downstairs if you hear him. And we also have, last but not least, Mrs. Yannick Williams Adeniji. She is a licensed social worker serving our District of Columbia, Maryland, Virginia, and New York, and is also the CEO founder of Full Joy Mental Health Practice, serving New York, Maryland, District of Columbia, Virginia. And she is our maternal mental health expert, focusing on postpartum 4th trimester. Thank you for joining us today, and I will allow Mrs. Zephanie Smith Eisenstadt to lead us in this charge.
Oh, thank you so much, Dr. Green Ediale. Thank you to everyone. Aloha, first of all. Thank you so much for joining us. We are live on a Sunday night, and we recognize there are so many places and spaces that are vying for your attention during this prime real estate of a time frame. So we're so grateful, whether you're joining us live or tuning into the recording on a later date, that you have chosen to share this time and space with us to explore and to examine critical topics, some of that which Vice President Harris has identified as one of her top 3 priorities, and an issue that matters to many of us who are on the call, whether you're seeing the faces on the panel or not. Those of you who are in the audience, many of you have dedicated your lives in response to your own lived experiences, the experiences of our mothers and daughters and sisters and neighbors and aunts, and even those who aren't mothers, which we'll get into as well, through your scholarship, through your advocacy, through your entrepreneurship. So even with the gravity of national and the global conversation, you are going to get to hear and engage tonight from some of the practitioners and program providers and community frontline leaders, which is truly where the rubber ultimately hits the road. They're doing the work. All right. So I enter this space first and foremost as a mother, a Black mother, hopefully a phenomenally Black mother. That shirt is a different color. That wasn't going to work well with the virtual background. But I want to shout out to Phenomenal being the Nurturing Wahine Fund for the merch indeed. I consider myself to be a newer mother who supports this work as an advocate through our family's philanthropy, board service, and someone whose background is actually in government and education. So before I kind of bring our panelists onto the stage, I do want to bless and acknowledge this space that's been entrusted to me to shepherd through this first conversation, which is part of a series to come. And again, to honor those who have committed their lives to this work as public health experts. So just take a moment to to breathe in, and let's hold space and acknowledge the literal land on which we're taking up space. We're sitting, we're standing, or otherwise. And go ahead and exhale gratitude, gratefulness for the history and the stories of generations of mothers who have existed in this very space where you are, and we're all over the country this evening. But folks who've occupied that space since the beginning of time. And if you want to learn more specifically about the land on which you stand, I invite you to visit websites such as native-land.ca, where you can type in your address or location and learn something and do something to honor the history of the space that you're occupying. Second, I want to invite you one more time to take one additional collective breath in. We're all here together. Let's exhale gratitude, hopefulness, And best wishes to Dr. Green Ediale and the leadership team at Black Mom Society for having the foresight during these times to convene this space. And then lastly, thanks again to every one of you who answered the call. Thank you for your patience and bearing with us as we navigated through some of the technical challenges. It's with you that we create this space. Without you, we would just be recording a podcast. But tonight we are here to have a conversation. We've got some very important and exciting folks for you to meet. All right, so now I'm going to quickly get us into the meat of the conversation. So do yourselves a favor. You'll want to grab a writing utensil or pull up the notes app so you can jot down some of the gems that are getting ready to fly your way. And with that, Dr. Green Ediale, if you would like to, I think, go on mute. And we are going to get into it. I'm going to invite Dr. Webb to come off mute. And we're going to start with a round of sort of introductory statements in the form of questions. Dr. Webb, let's start by talking that we're coming off of Black Breastfeeding Week and some of the other commemorations. Let's talk about the significance of breastfeeding for maternal and child health, as well as some of the challenges that Black women particularly face in accessing support for breastfeeding, which is the literal nourishment in an exchange between mom and baby. Welcome to the platform. Thank you for being here. And Dr. Webb, this question is for you.
Thank you very much. And thank you, Dr. Green, for such a wonderful invitation. As our beautiful hostess has said, this is a very timely conversation, right? And we're all moms here. I will fully disclose my 2 kids are now young adults, but I could remember them being the little babies that we can talk about. And I know that breastfeeding is probably one of the most wonderful experiences that I've had as a mother as well. So as a professional, I always encourage women to breastfeed their children. It's so vitally critical right now, and for many reasons. So first of all, we know that breastfed children actually thrive better, especially Black children. We have had a lot of misconceptions over the years where we've always been told that by hospitals and pharmacists as well, start your kids on formula as soon as you can, and that breastfeeding is only for a few days and, up to 6 months. However, we recognize when we look at other populations, white, Hispanics, Asians, all of them are breastfeeding their women. We are severely behind everyone, all right? And so part of it has to do with historically, Black women back in the old days. You probably are familiar with the term wet nurses, where enslaved Black women who had children were called by their masters to feed their masters' children, the babies. And then when they would go back home, their own children basically got very little in terms of their milk supply. And so unfortunately, we have used these data for over the years and came up with this myth that Black women do not breastfeed well for several reasons. Their milk won't flow, etc. And so there is a inclination towards providers putting Black babies on formula fed, for nourishment, instead of encouraging mothers to breastfeed. And I think that, that historical perspective is something that we need to change. We have to understand every baby that comes out of your womb and into this world also comes with a breast supply of milk. All right. The most important food for our children in the first 1 to 3 days of life is actually breast milk. All right. So there's something called colostrum, which we call the liquid gold for babies. It's rich in antibodies that will protect their immunity, and the best form of nourishment for our babies. And so later on, within the 5 to 6 day of life, that colostrum becomes what we call mature milk, which is where it's watery down a little bit, but it has more fat, more protein, etc. And it's just the right amount for the baby to digest. When we put our kids on formula milk, which is cow's milk, right, most of the times, it's heavy with more proteins. The baby is not fully developed. So most of those children, they can have everything from ear infections or at least an increased risk. They do have more propensity to being overweight babies as well, because they haven't had the body hasn't had the opportunity to grow into how to digest these proteins, etc. We see an increased risk of diabetes, an increased risk of asthma and other respiratory illnesses, and of course, the increased risk of SIDS with kids who are on formula fed babies. And so these, if you notice, most of these diseases impact us as Black people, right? And so there is a correlation. Remember, the very first meal was supposed to be breast milk, and it is sufficient for our children. They have very tiny tummies. So giving them anything excessive or more than what the body is designed to intake can create a number of health problems. So we know a number of benefits, everything from bonding, increased bonding for moms and babies, to the health benefits, to the fact that it's actually affordable because it's free. Right? And we make it naturally. So these are, just some of the many, many, many benefits of breastfeeding. And so I really want to encourage all of you who are listening, if you are young mothers, don't stop. And don't let people tell you it's up to 6 months. Sometimes, depending on the village that you come from, women are breastfeeding kids until the age of 12. And it's not because that's 12 months, yes. But it's not because it's the only way the child can be nourished, but rather there are so many benefits, including the bonding experience, right? So we need to make sure that when we are trying to seek the best well-being for ourselves as moms, as well as our children, that we are really going to credible sources. And let's not get hooked up on the myths, because we are doing an injustice to our children and interrupting our own experience. Thank you.
Thank you so very much. So Dr. Webb comes to the conversation as a physician and has highlighted some of the ways that we hit the ground running as mothers to provide nourishment to our bodies and the strength that our bodies have. And also some of the challenges, because there are a number of nuances and complications that particularly face moms of color in accessing that strength. And as we progress through the conversation, those of you who are watching and have questions about your respective journeys or some of the ways that we can help to foster increased education and supports around the Black mom breastfeeding conversation. We'll get into that later on in the conversation. Now I'm going to bring on to the stage Colette Cyrus Burnett, who is the CEO and founder of Global Food Warrior, who's going to be discussing another form of nourishment, and this applies to every last one of us, and that is through sustainable agriculture in maternal health and speaking to nutrition more broadly. So as we contemplate sustainable agriculture, Colette, I want to invite you to share with us a little bit in your introduction about its connections to maternal health and nutrition, particularly as it relates to providing locally grown nutritious food to support healthier pregnancies, recoveries, and overall communities. Thank you so much for being here with us.
Thank you so much, Stephanie. I wanted, the best way that I can possibly begin this is to piggyback off of what Dr. Webb was talking about, which is around maternal milk. And for us to produce the type of quality of milk that we'd like, it goes a little bit deeper in us being able to access the right types of food. so that we can feed ourselves well as mothers. I too am currently the mother of one young adult son and had challenges as I grew up, as I managed through my own experience with just being able to breastfeed. And a lot of that comes from the type of food, the quality of food that we ingest. For me, sustainable agriculture starts with us understanding that there are challenges, even in New York City, where I sit right now, around food deserts. And there are challenges that are really managed by people like myself, people who are within communities. These food deserts are where we can find a McDonald's on the corner every day, or a liquor store, but no fresh food. And so for me, when I consider what would be the best outcome for sustainable agriculture, is for us to be able to not just have healthy food, but really accessible food that is affordable as well. So food security is a major challenge that some of us are trying to hurdle, even in the most expensive city to live in, New York City. We have those of us who our children are going to school hungry. So I have had to address such as these issues specifically in schools, where some parts of Brooklyn, about 10% of our kids are going to school hungry because of an inaccessibility to quality food. And as we talk about Black moms in particular, I recognize that some of the challenges that we have are very, very different than others in other races. And it is something that we need to be aware of and be able to deal with directly. So, for example, I had a challenge when I was pregnant around maternal diabetes. And it was because, again, I didn't understand the choices that I was making as a new mom. So conversations like this are so important. And I really appreciate Black Mom Society and Dr. Green for making these types of conversations available to us, because I wish they were there when I was going through my experience. But I'm grateful to be here to be of service to those who come after me. So as we continue the conversation, we'll talk about a little bit more details about how we can ensure that we are taking great care of ourselves as we feed ourselves and our families. But that's why I'm here. It's important to me that we understand that the foundation that we stand on, the food that we eat, must be our top priority.
A top priority indeed it is. And thank you so much. You wear a number of hats that we haven't covered yet in the conversation in providing these nutritious meals out into the community. So we want to thank you and acknowledge you for the work that you do to practically apply the concepts that you're talking about, and to also invite those of you who have specific questions to start to jot those down, and they'll make their way into the conversation as we progress. Thank you so much, Colette, for being here with us and for your literal labor of love and service through agriculture. So we're going to pivot a little bit, and I'm going to invite Yannick Williams Adeniji to come on to the stage. And Yannick is a PhD student, so we'll be calling her doctor sometime soon. And she's at the Howard University.
Me too.
Also is a social worker who is focusing on maternal mental health, postpartum, and the ever important conversation around the fourth trimester. And we're going to get into some discussion a little bit about her groundbreaking research and the topics that she's exploring. But why don't we just start by setting the landscape of understanding here around maternal mental health and some of the issues like postpartum depression and anxiety that show up during the fourth trimester that sometimes, some folks on the call may even be hearing about these for the first time. So let's just start with some general understanding about what is maternal mental health and what are some of the unique challenges that are faced by women after giving birth and during the pregnancy journey as well.
Thank you. Thank you so much. And just like everyone here on the panel, I am just so grateful to be here. Just really to have this conversation, this open conversation regarding the maternal health of Black women. Maternal health care, mental health care is any diagnosis that has developed not even during but even before, when you start to believe or think like maybe I want to have a child, and then the anxiety may hit. Then we think about the first to the three 1 to 2 to 3 trimesters, where women, anything from depression to anxiety to even OCD, where a lot of people do not explore when we think about Black women. The fourth trimester is anything after, the sense of sometimes out of control that many women may feel. What we know is Black women specifically have the highest perinatal mental health diagnoses, but they are the lowest treated for so many different barriers. When I was thinking about what Dr. Webb was speaking about, just having that connection to slavery up until today, that is still indicative when we think about the mental health care of Black women, and how they are seen, and the resources that are just really not there. Currently, Black women who go through so much mentally during having a baby, during the pregnancy, the research is extremely minimal. Most testing is extremely minimal, and Black women and women of color are the least screened. And when we do think about screening, we are just thinking about screening about postpartum depression, but there's so much, the gamut of perinatal um, diagnoses is wide and stretch, but they are unfortunately not documented. Black women are the most misdiagnosed or underdiagnosed. So it is so important for Black women to be able to advocate for themselves, and really begin to acknowledge and feel safe enough to say that I mentally I need help. What we know is that Black women sometimes hide their feelings because of community stigmatization, or even fear of being seen as a bad mother, or having CFSA being called, which we know has the highest prevalence when compared to other women who are able to seek care. So I think, just being in this space to talk about the necessity of mental health care is just very important. And I speak not just as a therapist, not because of a researcher, but even as a mom. I was pregnant with twins during COVID, and the help of mental health care was very far and few in between. And then the necessity of seeing someone that looks like me was extremely hard. And that is actually one of the reasons why I stepped into this role of advocating and providing maternal health care for women of color, because what we know during race concordance is that treatment sometimes or mostly works better if people feel they can identify with the person who is treating with them.
If ever there was that question to be asked, what's your why? Everyone in the room who, including myself, was pregnant or gave birth during the height of COVID times. I mean, that is a huge impetus. And I want to give a special shout out to, I don't know how many of these there are in the world, but the University of San Francisco's created a Black wellness clinic. I mean, we've had to be innovative on every the forefront to address, you've got these issues, and then you've got these issues amplified during COVID times. So kudos to you for taking the challenges of that journey firsthand and already spinning it, to have it inform your research and your work as a practitioner, as a researcher, otherwise. We are going to quickly get back and bring you back onto the conversation in just a moment. But before we get into some of the nuts and bolts of how we deliver this and how we address some of the additional challenges and infrastructure and otherwise around maternal mental health as a function of overall conversation of mental health, I do want to bring Yasmin Lachman to the stage. Let everyone meet Yasmin. Now, Yasmin is a public health expert, and I bow down to the public health experts that have helped us to navigate through COVID and through all of the evolution and advancements of technology. Someone who's going to share with us from the perspective of an undergraduate student at Stanford University, who is here today representing the Washington, D.C., Maryland, Virginia, DMV area, St. Vincent and Grenadines Mutual Aid Relief Fund. Now, you may have heard the accents, and you may have surmised that perhaps this is a Caribbean maternal health conversation, because we've got lots of wonderful representation. But I do, Yasmin, want to invite you specifically to speak to women who are from some of the communities that you all represent and beyond. But what are some of the unique challenges faced by Caribbean women, and what are some of the solutions for improving access to care that you're working on, through your scholarship and through your work? Welcome to the platform, and thanks for being here.
Thank you so much for having me. I'm so happy to be here. I'm probably going to be a bit shorter and sweet than everyone else, but I do just want to kind of talk about what the MVSVG does. So they are an organization that has been founded by one of my good friends, Diamond, and as co-founder, she focuses on a lot of different relief efforts. I'm sure recently you guys heard about La Soufrière erupting. That's the volcano on our island, and she was able to help with relief in that sense, and also recently with Hurricane Beryl. And in relation to maternal health, Diamond's organization pays special attention to what women in the community need, including period products and education programs, women empowerment, etc. And so coming from the Caribbean and being on an American platform right now, I think it's quite obvious that social media has a huge impact on the perception of women's health in the United States and outside of it. And that's kind of what we're seeing, at least in my generation. A lot of the information that we're taking in is from America. And so watching from Barbados, Roe v. Wade being overturned, for example, has a really strong ripple effect in communities that we may not think about right away. And so that's kind of what Diamond and I do. We find those communities that need to have access to science and accurate, educational materials, period products, and things like that in order to help them be empowered about their health and start their journeys from a place of confidence and knowledge. So, yeah.
And indeed, the journey for all of us starts with confidence, knowledge. I want to thank you specifically for the work that you do. As I was learning more about your background, those who are watching, please take a look at either the chat or the comment section or the description of this event so that you can grasp the fullness of what each of these panelists brings into the conversation by reading their full bios, visiting their website, seeing some of the work that they're doing. We just briefly mentioned on some of that, but I also want to acknowledge, a lot of these issues that we're talking about, and we'll bring all the panelists back to the stage now. Thank you so much, Yasmin. But they hit so much more close to home than we realize. I had to take a moment just to remember Erica Trim, who, like me, is a former White House intern. And just weeks after I gave birth, she did as well. And unfortunately, she passed away due to complications following the birth of her sweet baby boy, also a young woman from a native of Tobago. And so whether it's, as we get into the flip side of the conversation, which is essentially, well, what happens when care goes wrong, when care isn't there? We start to introduce now the conversation, which again, when we start to investigate, it hits a lot closer to home for many of us than we realize, around maternal mortality, disparities in the reproductive health care. And this is one that I didn't learn about until after my own lived experience, not just the maternal mortality, but the prevalence of maternal morbidities that face particularly Black women and women of color. And so I think I'm going to kind of bring Dr. Webb back up to the top of the conversation to discuss and address some of this area. And we're going to talk now about care. That's for, specifically some issues around care, what goes well, what we need to be doing, but then also the flip side of what happens when it isn't there. So Dr. Webb, why don't we allow you the time and space to offer some reflections here as we get a little bit deeper into some of the topics that were presented.
Sure. And thank you so much, Stephanie, for sharing that information, right? It's so important for us to understand that, we do have a high mortality rate. In fact, usually most of the deaths that we see with the mothers aren't the ones necessarily during childbirth, but actually immediately right after, as soon as the patient is discharged home. And this is where we as a community need to understand that there has to be more resources, more support for young mothers, especially when they have to leave the hospital. Everything from making sure that they're physically in a good space, that they are getting the care that they need to. When we look at just in the United States alone, I know we talk about other countries, right? But just in the US alone, over 2 million women do not have access to supportive obstetric care, especially, around the time of delivery. Okay, so they may use midwives, they may use doulas if available within their communities. But in terms of actual hospital settings, some of the babies aren't even born there, right? So we have the complications that we will have that our doctors can take care of. And then there are complications in the aftermath of having a child. And of course, we don't want people to diagnose themselves or what they're doing. This is not part of what they're trained to do. They are trained to be moms, and take care of this new life that's coming to them. But our women, especially Black women in our communities, if we get the necessarily prenatal care and really follow through with the physicians, then it helps us. In fact, within our community, we wait for something to go wrong and then we go find doctors, all right? Or people, especially our young women, they say, well, I'm pregnant, I just have to take prenatal vitamins and that's all. But it's so much more to that. It's everything from eating well, making sure you're not mentally stressed or, overly stressed, right? So having a new child is a new experience. There's so much that you don't know about. And so you have to understand your body's going to go through changes. You're going to have hormonal swings up and down. And so it's all part of the process. So when you have good prenatal care, you can follow through with someone who can advise you. These changes will come along the way, but it's normal, right? You're not the first woman to go through it. You can get through it. So all of these are what we call preventive strategies. And prevention in itself is a form of medicine, right? So when we have complications, as in the case of your friend that you shared about, some things are, on the medical side of things, and there is nothing necessarily the patient could have done. to change the outcome. So what I want to make sure that every woman knows, not just because you're a Black woman means you're going to necessarily have the complications. It's really down to getting prenatal care. And I love for our speakers who shared the fact that you also want somebody who looks like you, who may understand our complex history, who may understand that, we our support systems can be different, right? So there's a role even for that. So earlier I talked about breastfeeding, even something that simple. It's important for women to pump and be able to give the father the bottle so he can bond with the child. It may not be the same physical experience, but it's all sharing. And not just fathers, but sometimes aunts. In the old way days, it was grandmothers, aunts, everybody was there to support and help the parents as they get, especially for new moms. You are going to be feeding right through. Some women every 2 to 3 hours. For some women, it's every 1 to 2 hours. You really just have to pay attention to the cues that the baby gives you. And so, for all of these reasons, we need extra support, right? So when you're tired, I always tell moms, sleep when the baby is sleeping. And then you're up when the baby is up, because that child needs you. You can't tell the child, well, mommy's tired now, you need to wait. We really have to be that advocate. It's all about this little life, and that's where we pull support systems. But then on the professional side of things, I really think it's important for young mothers to have support for lactation. So even everything from lactation education classes and teaching you how to, naturally bond with your child through breastfeeding practice, etc. But they also teach you practices about hygiene, paying attention to changes in your body. If you start feeling a fever, or you feel sudden changes that weren't there before, that is a flag to you to seek immediate medical attention. Many times you don't understand as a young mother, because your body is going through all these changes, what might be different and might be alarming and potentially is signaling there might be something else going on. And so that's when you get the immediate medical care that you need. If that means returning to the emergency room, if you have to, or at least the hope is that every woman would be tied to good perinatal care, and so they have a relationship with their obstetrician, right? And so you can put that call in. So most of the issues that we see around the complications really come from lack of education or information sharing, so that the parent or the new mom understands there are changes that will go through your body. So yes, you're focused on this new baby, but pay attention as well to your body, and that's why the support is so necessary. But the more we have good perinatal care, the more, or prenatal care, the more that education piece comes. And then the entire team is there, the nurses, when you're being discharged, good instructions, etc. So I encourage women to drink a lot of water if you can after the experience. I know you're in pain, you're swollen, you've just gone through a very difficult time. But the water not only helps with milk production, but it also helps relaxes you, especially if you are mentally struggling and emotionally struggling. Those emotions can transfer as well to the child. So it's important that not only you're getting the physical support, but also mentally making sure that you're letting go of the stresses that you can. The whole process is stressful, right? But I want you to know that there is hope. And just because we have the highest mortality rate as Black women doesn't mean we cannot do anything and take that power back, so that we can lose no more women, not unnecessarily, through the process.
Absolutely. Very well stated, Dr. Webb. Lots of rich content here. I'm going to invite all the panelists to come back onto the stage just to kind of weigh in here. We're going to try to create a little bit of an arc. So we're talking now about some of the health disparities, but also some of the key strategies for reducing those disparities in maternal health and mental maternal health, particularly in areas where there may be limited access or challenges that have gone unnoticed or unaddressed. So before we kind of transition from this space, I'm going to invite some of the other panelists to weigh in as well. Perhaps what are some of the best practices? And some of you are doing work more locally, others in the global context. But if you'd like to weigh in here about strategies around wellness prevention or providing that necessary medical attention on the other side, are there strategies and best practices that either you're inspired by or that you're working towards through your respective programs, or hope to see increase in terms of implementation in underserved areas in the US and the diaspora more broadly? This is for anyone who'd like to jump in.
May I?
Please.
So in my practice, what we do know, and just not even just in the perinatal mental health access, but when we think about the whole broad spectrum of mental health, right? I know when you're in training, everything is from a European lens. You learn all of the expertise when it comes to theories and all types of things. I know personally for me, I ground all of my trainings, all of my practices, especially when I am working with Black women, especially women that are going through postpartum, during, and even before, when they come in and say, my health is not the best, but I want to have a child. I lead from the Black feminist perspective. And what that means is that I'm putting the woman first. I am executing a space where you can kind of shed the strong Black woman complex that we all struggle with, just because that's just the way it's always has been from slavery to now. This idea that Black women are supposed to have like a cape and can move mountains and can sprinkle magic dust and everything will be wonderful when it's not. And I make sure that rest is resistance. This is a book that I read constantly, that I give to my clients, to say, like, to resist, to rest is to show that I am human. Even in the sense of being a mother, I tell them all the time, the baby is tired and you're tired. Bringing life and going through the womb to get to the world, everybody's tired. And so you are supposed to be exactly where you are. I also give grace, and I also let them know that you have to realize that it takes 9 months to make a child. So then why would you even think that, what is it? I think, what is it now? We can go back to work in 6 months, 6 weeks. If you're lucky, why would you even think mentally that everything's going to be okay? And so I think the more we normalize Black women just being people, being human, moving away from all of these stereotypes of you must be strong all the time. I think that in itself can just save so many lives. It can help, and to just really demystify this whole otherness of Black women and Black women, Black motherhood. And I think that that's kind of where I am and where I land when I am treating Black women and just women of color as well, because I have used the same perspective on Asian women, Indian women, anyone from the diaspora.
And we're going to come back, and as we navigate this arc, to talk a little bit more about postpartum, right? But before we do, I do want to get Paulette back up on the screen here. We need to normalize. I mean, those of us who are following some of these different doctors, we're hearing more about, it starts with the gut, right? And so whether it's maternal health or these different aspects of our health, we are starting to go deeper in our understanding. It's not just that the way to the heart is through the mouth. And even earlier, as we were in the green room prepping for this, the food has such a central role in our culture. And there's so many links that we don't even get around to thinking about and talking about. So I'm excited about us weaving that into the conversation. And kudos to BMS for having you here to talk about this link, right? It's in the importance of proper nutrition during pregnancy for mom, baby, and the community, right? And how nutrition can help improve maternal health outcomes, and the impact of food deserts and the lack of good nutrition also impacts maternal health. There's a lot there. I think if I wanted to try to put that into the format of a question, we could start by thinking about, Colette, how can we kind of marry these ideas of sustainable food systems and what you're doing innovatively with agricultural farm to table approach with this whole idea of holistic health? How can we better promote this link between sustainable farming practices and holistic maternal health? And maybe you can elaborate on how the farm to table approach that you espouse can positively affect health outcomes for moms in both urban and rural settings.
Oh, I love that question. I will tell you, Zephanie, as I'm listening to the other panelists talk about it, I'd like for us to consider ourselves from the place of nature, which we are so connected to nature, yeah? And as an agricultural specialist, my forte is to talk about trees. So I want for us to consider ourselves as trees and recognize that the root of our wellness is in our food. It really does matter what we eat. And it matters on every level, for moms, that new moms, moms that are raising young children, and us, each of us sitting here right now. And as one of the things that was most stark to me about why this is so important, it was actually coming through the COVID-19 pandemic. And every single one of us learning about what were comorbidities, a word that was not familiar or much used prior to that, but it became way too familiar in our communities. Specifically in Black and Brown communities, we lost many of our people, elders, young people, across the board. We lost so many because these comorbidities, which are all unfortunately correlated to food. Diabetes was a major one, hypertension, another, heart disease, another, all can be affected positively by us choosing to eat differently. So things like accessing great food should be the norm. It should not be that difficult. And one of the reasons I got into this business at all was because there are hungry children across the world, but there are also billionaires in the same world. And to me, it never made sense. I can't understand how we have people who can't afford food, but we have people who can hoard money to the extent of becoming billionaires. Now, I have no problem with billionaires. I simply think that if we want to address this food issue, this hunger issue, we need to actually do so with our actions. So, hyper-localizing food, for example, the growing of food, is possible now. There's technology that allows us to grow year-round, no matter where we are in the world. We can be in the middle of winter and growing vertically in a greenhouse, growing without pesticides. Recognizing that pesticides is one of the main challenges that we have right now. Because as our food becomes more and more industrialized, less and less nutrition is actually gained from our food. So as we are in the midst of an election season, for example, we have to understand that we hold power in our hands to address our elected officials. Let them know what's important to us. Send them letters talking about why are we not growing some of our food? Why is it that emissions from food production is so high because we have to transport it across states? We can't eat locally if we're not growing locally. Yeah? And study after study shows that if we eat locally, if we eat what's in season, the wellness within our bodies shifts. So as a young mom trying to navigate all of the challenges of hormones and figuring out what's the next, the best uh, system to supply their bodies with what they need, I want for us to consider our food first, even how we are preparing our food, because it being the root of all of what we are dealing with, it's not just physical health that food impacts, it's also our mental health. So as we choose what we eat, recognize that these things have either a positive or negative impact. And we are eating way too much processed food right now. And if as a community we could do one thing, I would ask us to cut out sugar. That would be, I know, most difficult, but also the most impactful to improving our health across the board. I talk about it knowing that I personally have a sweet tooth, so understand I know what I'm asking. It's tough, but it's also in how well are we taking care of ourselves and whether or not we want to discipline ourselves around having the longest and most healthy life that we can, not just for ourselves, but for our children, our families, our communities, our countries. That's why this is so important. If we understood that our gut is our actual first brain, and how our gut feeds our brain, that's the intellect that shows up on the other side. But before we could deal with any of that, we have to actually be well enough that we could even ask ourselves the questions of what else can I do to take good care of myself? So let's first start with the foundation of good food. The farm to table movement has been awesome, but it also is stilted in some ways by the industrialization of our food. So the more people that see value in growing a backyard garden, I live in Brooklyn, yeah, and I have a 10 by 10 backyard that's as big as a tent, and it's entirely concrete. Yet I grow most of the food that I eat during the summertime in that little backyard. I do it in containers. There are ways that we can grow our food and we can insist upon the food that we eat becoming better. There's no reason that we should have Lunchables in schools. Lunchables that has been tested for lead. So I question our leadership. Yes, I would say that out loud. I do question our leadership. If Lunchables could get into our schools, what system have we used to decide upon that? And as Black mothers, we need to step up and speak up. It is that we use our voice. I'm asking us to do that specifically because our food and the wellness of our people is dependent on it. Thanks.
Thank you. Listen, this was the part where I told you at the beginning of the conversation, for those who are watching, open up the notes app, jot down. We had some action items in there. We had some notes, some things for you to look up with. I want to pick up really quickly and bring Yasmin back into the conversation because we're going to talk a little bit, when we think about this whole notion of leadership and the extraordinary power that governments and policymakers have on, for instance, labeling of foods and allowing food levels. This hits particularly, I was on a flight next to I believe her title was a food engineer. I was flying back to California last weekend. And they are the ones who go in and provide the testing, et cetera. If there are younger people, if you have children, we're all about STEM and STEAM. So look into these careers because we're just at the tip of the iceberg and starting to really unpack and peel back the layers of the onion on how important our food is and how important it is to know what it is that we're eating, the impact that it has, et cetera. And as I contemplate youth leadership and the Gen Zs and those who are even younger than me, they're doing what you are suggesting, Colette. They are using their voices as advocates and showing up to engage in public testimony. I had a high school student here, and you'll like this, Yasmin, who lobbied the legislature and was able to get the pink tax passed for period products, right? But they're also learning at an early age to also vote with their dollars. We've got a whole movement around, reading labels and not buying products because the more right? The more we learn about even some of our non-sustainable period products, what they do to our bodies, what they do to the environment, et cetera. I'm so inspired by young people such as yourself, who are helping to affect supply chains, right? And going back to the food here on the island, there's a huge conversation about what we're bringing in and importing versus this whole idea of INA-based learning and cultivating the land so that we can survive. Now, I'm of the personal opinion that we're going to all need those skills sooner rather than later, and we're not going to get into that. But Yasmin, I do want you to come on and chat with us a little bit as a young leader and as an educator, the role that you see your peers and yourself as young people playing in advancing women's health and education, whether it's geographically in your region. That starts early because, as was said earlier, I think it was Yannick who said it, it's a conversation also about reproductive health. The maternal health journey begins when you become of age and you're starting to think about even giving birth, right? So share more about your journey. You started out as an advocate, for some of those sustainable period products, and all the way through to the goals that you have set in the vision you have in your future work as an OBGYN, helping to address what are some of those barriers that you were looking forward to addressing. What are some of the solutions that you're hoping will be implemented? You have a training, you have published curriculum, you're out there doing this. So for those who are learning about your work for the first time, why don't you just share a little bit about your vision for closing these healthcare gaps?
Thanks so much for all the kind words. And Colette, I did want to say that on Stanford's campus, we actually have the Stanford Farm, where we grow a lot of the food that all the students eat, and we all volunteer there and get very involved in that process. So I completely agree with you, and I'm very blessed to be on a campus that cares about that as well.
It's spectacular.
Isn't it? Yes. And so in relation to your question, I guess, I can share a little bit about me. So I am interested in all facets of women's health, but I think where I could relate the most right now and where I kind of started out was working with period products. So I am of Indian, African, and European descent, a combination which is completely underrepresented in research, specifically when it comes to like endometriosis and PCOS, heavy periods, fibroids. And so me and many of my peers were struggling to make pads and tampons work for us. We're having really bad cramping and really heavy periods. And this actually extends, beyond your teenage years to people who have had children and people who are approaching menopause. Periods are hard and they're a part of a woman's life, regardless of, where you are in that journey. And so I kind of started out working with a disc on my own time and trying to figure out how to make it work for me. So a menstrual disc, for anyone who's unfamiliar, it's made of medical grade silicone and it's inserted into the vagina and collects your menstrual blood. And it has a lot of advantages. For example, you can leave it in for 12 hours. So it's a lot more convenient than other types of period products. And for people who are busy or for young moms, this can be something that really helps you find more of a balance when you're on your period. Don't have to think about it so much. There's actually some research out there that says it causes less leaking and less cramping. So seeing all of that research and knowing my background, I decided that it would be really important to kind of spread that work into the Caribbean, where there is absolutely no access to sustainable period products. And so they'll send these materials out to you if you're interested. But I've published a curriculum which can be taught by anyone and is super colorful, as my Caribbean constituents would want it to be, where I just talk about what these products are: menstrual cups, reusable pads, period underwear, menstrual discs, how to use them. I brought 1,000 of these products for free to the Caribbean this past year, and I've been teaching sessions and handing them out. And as I mentioned when I started, I think a huge barrier, especially in Barbados and St. Vincent, to care is simply the the sort of the knowledge. If you don't know what to ask, then you're not going to have a question. And so I really am just trying to create that foundation for people who might not know much about their period. They don't know what their period is. They've never inserted anything into the vagina, and they are scared to do so instead of choosing not to as an empowered choice, right? And so I published that curriculum and brought those products in the hopes that that can kind of lay the groundwork for my future work, where I want to continue working in the educational space, but I also want to move into more facets of obstetrics and gynecology. And so in the future, I'm really looking to address some of the barriers in the Caribbean to menopause care. And as many of you will eventually approach, there isn't that much information about what things you can do when you're approaching menopause or what's even happening to you. And there's also a lot of fear around hormone treatments and hormone replacement therapy. And so towards the future, I'm kind of looking to increase education around those topics and kind of break the same barriers that I hope I have with sustainable period products, so that people know what questions to start asking. And in addition to what many of you have said, I think it's so important that we have medical professionals that look like us and that come from our backgrounds as well. There's very few Caribbean doctors. It's lovely that we're able to have some on this panel, but it's very hard to find someone who gets your background and your culture and your whys behind the medical decisions that you may make. And so part of my goal in the future is to be one of those providers that can connect with Caribbean patients and Caribbean women who are looking for support in lots of ways. So yeah.
Wonderfully stated. Thank you so much for committing your life and your work at such an early age to this. And if there is a way for us to drop a link in the chat or otherwise promote the reports and curriculum that you've come up with, I want us to certainly be amplifying that. I'm going to pick up where you started by bringing in all of you and all of this, these different aspects of your identity. I know that Yannick is working to address this through cultural specific research and treatments. And you talk a lot about, right, this notion and this necessity, frankly, of dismantling the stigmas around maternal mental health for women of color. Maybe you can share just a little bit more about what you see as some of those critical gaps in care for this population and how they are being addressed, if there are innovative approaches that excite you, that inspire you, or will be addressed through your vision for the future, which is through the culturally specific treatments that you're developing that aim to close these gaps in maternal health care and generate equity.
For sure. So just, I believe it was Colette who said it was COVID, right? It's, as a Black woman, it struck me. I would remember watching the news, and we kept hearing that so many Black and brown people were dying, being sick. But then there was also a side where we knew this. The racial disparity was extremely high, and the research started to just kind of say, Black people, brown people, Hispanic, but we kind of knew it's always been like this. It's always been harder to get care. It's been harder to get care for especially mental health care. So I stepped into this role knowing that women of color are being misdiagnosed, underdiagnosed. Depression is most postpartum depression is really something that even in the Black community, that we just don't kind of talk about. As a woman of Caribbean descent, I've never heard of an aunt or a mother or a grandmother even talk about not only the process of having a baby, what was that like after. Hold on, I think I have. Yeah, I did. I didn't have anyone to kind of talk to. And then when we think about the need of having someone that looks like you, that in itself is just extremely hard. So the work that I've been doing and the research that I've been looking at is really looking at how women of color, specifically Black women, are being screened. Literature shows that Black women, because there is a history of fear and just kind of mistrust with Black people in general, telling a doctor exactly how they feel and what that may look like, especially a Black mom, and how a Black woman will be perceived, how she shows up. And even the tools that are used to scale what that depression looks like. So it is my hope that through my research I would be able to create or assist with the creation of a tool that encapsulates not just postpartum depression, but the unique depression and anxiety that Black women face. Because what we know is that women of color, even just being a pregnant woman, it's a moment of just anxiety. If you know that you're a Black woman or you're a woman of color, just out of because you were born that way, your child has a higher vulnerability of death, or will be born earlier than a child that is white, or may not make it until that child will be one. Or even you as a woman, knowing that because you are a woman of color, you have more vulnerability to get gestational diabetes or preeclampsia, then that in itself is just walking around with a state of just anxiety. And no, if you're not a woman of color, you're not going to understand that, right? You're not going to understand that just because I'm Black, if I walk into this, I may even make it. I've done everything right, right? There is a Miss Colette in my life, and I'm eating right, and I've done all the. I know that I'm going to give my baby. I'm going to breastfeed because I know Dr. Webb, right? Because I'm in every session that Dr. Green has when it's a town meeting. That my therapist, there's a Yannick, there's a Ms. Williams Adeniji, but still, just because of my race, I may not even make it out. And I've done everything right. I'm at 38 weeks. That kind of fear, it's a different kind of fear just because of who I am. And I've done everything right. And it doesn't matter your education. It doesn't matter how many degrees you have. It doesn't matter where you live. Clearly, we know if you live in different sectors and you are in underserved, you're higher, but you will always be, the uncertainty will always be just higher than ever and most. That's a different kind of anxiety. That's a different kinds of depression. And on top of everything, you come from a community or a ethnicity where we don't even talk about the fourth trimester, that fear, that sadness, that I love my baby, but I still want to go to school. I still want a career, but everyone's telling me I should just be grateful that I have a child. Why are you sad? So, and then on top of that, you have the whole concept of being this strong woman so you can't break. So then what do we do? So it is with my hope to know that with research, which we also know that women of color are very under researched, but we have the highest perinatal mental health disorders, and so it is my hope that through true research as a woman of color, I'm able to weigh in when these new tools are being created, or even to even question, why has this even taken so long?
Well, one of the reasons why we know that it's there are time challenges, right, is because we have decision makers and folks who are in positions and making decisions about things for which they need to be on the Zoom right now learning something, right, from all
For
of
sure.
you. And I'm going to bring Dr. Webb back up to talk a little bit more. Let's go a little bit deeper in the responsibility and the opportunity that we have, not only as practitioners and educators and program providers, service providers, et cetera, but we have to be advocates. And we got to reach one and teach one and train others, whether they're mothers or otherwise, they have a mama, all right, to also be advocates in these spaces. And as we're preparing for the town halls that are taking place, particularly during the election cycle, where you're having an opportunity to hear directly from candidates, we need to be thinking about the questions and issues that we want to bring up so that they know on the other side, once they're elected, yes, we're going to be there to hold them accountable. We're going to be showing up and participating and having hearings and testifying and things of that nature. So I want to, Dr. Webb, maybe we can pick up on this idea of disparities in research. Yannick just talked about the disparities in some of the research around maternal mental health. Yasmin talked a little bit about issues, which is a whole other conversation, right? Endometriosis, PCOS, heavy periods, fibroids, all of these issues that are plaguing our women, for their moms, as their moms, it's all connected, right? It's part of the reproductive journey. How do you think that policymakers and community leaders can better collaborate, more efficiently, more effectively to address anywhere from, chronic disease prevention and some of the issues that we've identified in the conversation so far, all the way up to promoting some of the solutions that we're also unearthing and discussing and discovering around improved outcomes for moms, for babies, for families, and as we know, the communities that these moms and babies are living in, whether it's here locally in the United States, but also globally. Please speak to what you're seeing on the policy side of things.
Sure. Very loaded question, but in a nutshell, I'll try to, condense my response. But I think first of all, I would say there's opportunity. We have not addressed this issue for, decades, right? So we're adding small pieces, but the solution is in policy makers and community leaders coming together. All right. So first of all, let's talk policy. Policymakers really follow what the data says, right? The data, if we really look at the data, we see that there's so many gaps, that there's so much work to do. And unfortunately, I think there's so many communities where we haven't captured the data, right? So the question is, who is the Black mom, the Black woman, the Black, where are the issues? And we do not capture that data in the correct way. So I think, first of all, we need to do a national study. I need bodies like WHO need to do a global assessment as well, and really narrowing down to what's happening with Black women. Why are they the ones with the highest mortality rates, maternal, mortality rates, and even infant mortality rates, right? So if we could get the data, data drives where they shape policies and where they fund right? So we need, because we don't have the numbers, we can't push the money where it needs to be. And when I say money, I'm talking about in terms of funding education and awareness programs, in terms of funding more researchers who are in these communities. Many of these researchers need to be those that look like the individuals. I know many not Caucasian led organizations that are running grant research projects about problems impacting Black communities. And I don't know how you can be totally effective if those that are posing the questions that we're studying do not completely understand the complexity of that population, right? That's just an example. It's happening across all sectors. And so I think that we need to understand, we need in especially in Black communities, because historically researchers have come in, got done what they had to do, and they left. There was no follow through, no programs, no implementation of any programs that could really help the people. And so as a result, whenever we come into a community, a health disparate community, no one wants to participate. You literally have to give them free food or some kind of a gift card for them to show up at the events, right? And so we need to change that. People are they have the right to good reproductive care, to accessing, all the medical resources they need, community resources, even within the workplace, right? So I talked earlier about breastfeeding. That's not my area of expertise only, right? But I'm using that as an example. We need workplaces having policies that accommodate breastfeeding moms, for example. Yes, we have paternal, vacation, etc. But what about having rooms that moms can breastfeed, if especially federal agencies or larger organizations, nonprofits, etc. Right? So there's a cost factor for that as well. So I think everybody should be allowed that line item in their budget that they have some kind of whether it's education programs for these moms or just creating that environment where they can breastfeed without the stress of, oh boy, I have to rush, I only have 15 minutes. I mean, sometimes it takes a little longer than that. So we need to have more flexible policies within the work environment to support working moms, right? Breastfeeding is just an example, but then you have the moms who have kids with disabilities and other challenges, etc. We need workplaces to actually have education awareness around those programs as well, right? So when we talk about policymakers, they need to know all of these challenges that are impacting our Black mothers. It doesn't matter the age of the child, right? From birth all the way to the 17-year-old child. There needs to be more support for them. And this is where we empower community leaders, because they are the ones who also may get the first access to the funding, even if a project is funded, but they may not be the ones who provide the solutions. So we have a number of excellent nonprofit organizations, small clinics and practices, social work clinics that can do the work. They need to be a part of it. So even when these grants or funding opportunities come out, they should say, well, we need at least 6 or 7 partners, and they should be in all of these different categories. And so it forces our communities to work together, because this problem that our moms are facing with or the challenges they face, it's a village problem. It is a community problem. So the solution has to be a multidisciplinary approach, but bringing in all the members of the community. I mean, we should have food programs that Colette, her organization, they've been looking at food and connection to health. Every community needs to have a link of that. These are the types of foods that we should recommend for these Black moms, and hold these states and cities accountable to make sure they actually exist. the farms, the free pesticide foods, etc. Right? So these are ways that we have to make sure that our grants, otherwise we put it out as, oh, just come up with an innovative approach, right? But we need to make sure all the partners who are important as well are included. And this doesn't only go for the US. This is every place all over the world, because our communities, because we've been left behind, those who really care are trying to find out creatively how they can answer these challenges. And I will tell you, some of the most creative ideas are coming out from the most unlikely communities and zip codes across the globe. So we can learn from them, pulling in all these best practices and then scaling those models, right? So when we talk about policy change and community leaders, yes, they must be part of the solution for addressing this maternal health crisis that we face in our health disparate communities. But we have to bring in other sectors in the community that, truly have the solutions and start funding them. We keep funding the same organizations over and over again. That's why we're not seeing change, because we're not bringing the players that have impact to the table. Right? So that would be, in a nutshell, how I could best sum it, to your very loaded question. Thank you.
Absolutely. And we're going to bring in everyone to kind of react, to respond, and add. And we're moving towards the closing, right? So there's a couple things that I think we want to accomplish with these statements as we continue this roundtable around the room, the virtual room that we're in. It's about, what are those policies? What are those solutions that we absolutely need to be understanding, organizing, and advocating for right here, right now in our communities, right? We have elected officials, and I love it. I'm from California, and they have, usually the legislatures will do this program or competition. They say there ought to be a law, right? And I saw, Assemblymember Wilson and some of the others will put it up on their website, and you can go in and say, there ought to be a law that does this or that does some of what Dr. Webb just talked about. So as we invite you all to close, and we're going to probably go, maybe we'll go to Yasmin next, right? So what, in addition to sharing your vision, dreams, and hopes for the future about some of those specific issues that we need to mitigate through policy and to address, also feel free to jump in and share if there are best practices that you have seen, and tools and resources, because just bringing in what Yannick said as we were preparing for the call, the conversation we just had tonight isn't just for moms. This is for everybody. There's relevance and there's significance to what we're talking about and with these action items. And each of the perspectives that you all brings impacts the overall family and the community. That's why we have the Commission on the Status of Women and Women's Movement, because we know that when we strengthen women, we strengthen the community. And when women succeed, America succeeds and the world succeeds. And we need more women who are in the position to make the types of policy decisions that we want them to do. So I want to just open up the floor for your final reflections. Do the best you can with the limited time that you have. If you want to talk about policy and best practices and things that you've seen that you'd like to see more of, feel free to share that, but definitely leave us with some reading assignments. I am an educator. So if you want to drop in, things that you'd like people to follow up on, websites or things of that nature, this is the time to share those actionable items as well. So we're going to start here. Let's go with our voice of the future, which is now, with Yasmin, and then we'll bring back in, I think we'll go to Yannick, and then we'll close with Colette before Dr. Green comes back and gives us our closing in about 10 minutes. Over to you.
Well, Dr. Webb, thank you for that very nice nutshell overview of a lot of the changes you want to see. I couldn't agree more. And as the voice for the future, I kind of want to hone in on something that is just really close to my heart, which is sex education. And as we've seen in states like Florida, where certain parts of a well-rounded education are not allowed anymore, I think some policy changes that would be really impactful is just a universal requirement that we have a comprehensive conversation about anatomy and sex when kids are young. I didn't get this when I was in school, and I think it kind of waterfalls onto all other parts of your life. Not only when you're going to the doctor because you want birth control, but also when you're having a baby and when you're approaching menopause. And so I think women are not only underrepresented in research, but also underrepresented in how we reflect that research back to the young people in our country. And so I think it's just really important for us to advocate for education as a whole, but also education that is encompassing different cultures and perspectives and races, and that is based in science that includes us all as best as we can. Now, as Dr. Webb mentioned, we have some work to do in that way. But I definitely think that there's a place that we can start now where we can, be open to those perspectives and share the science that we do have. So that's kind of what I wanted to say on the policy side. As far as tools and resources, this is a little bit skewed towards my own interest, but I do recommend that you guys all check out the Stanford Center for Menopause and Healthy Aging. They just came out with this whole program and hired an incredible menopause specialist to head the program, because as we've been talking about today, motherhood is not this sort of thing that ends when your child is 18. We continue to have various reproductive health needs and concerns. And so that center is working in a lot of ways on menopause policy in the workplace and also on making sure everyone has access to the menopause care they need. So check that out.
Thank you. I hope those notepads are out. There won't be a quiz, but maybe there ought to be, huh? Yannick, if you wouldn't mind jumping in on some of the solutions that you believe are needed to mitigate some of the disparities and things that we talked about, and then any actionable resources.
For sure. For the maternal health sector, I believe the most important right now is advocacy and knowledge. The more you know about your mental health during, after as being a mom, can really help. And it actually gives you a sense of learning to speak to your providers in such a way of knowing exactly what you want. I was just laughing when Dr. Webb was speaking about the breast, like this. When women they go back to work and they're breastfeeding. I mean, they're pumping, and it's just like this anxiety, right? I have had women where I actually sit down, I let them know pumping is giving you anxiety because all you have is 20 minutes. Let me write you a letter. Because you need more than 20 minutes. And I will tell you, I've gotten women up to an hour and a break. But if you don't know, you don't know. And you would be surprised how me writing one letter for one person has trickled, saying, oh, like, well, I know another person that's pregnant, and let me talk to another woman and this woman, and they cannot deny it because it's an accommodation, because you now have a diagnosis. But if you don't know, then you just don't know. And most, if not all, of the women that I've written letters for were women of color. So I just really want to see just women of color really understand that mental health is something that is normal, that I really would like women to be able to understand what their screening looks like and how providers screen women of color, because we have different unique challenges than other women. So that is kind of where I sit.
Thank you so much for your perspective. And I'm going to take it to even another level as we bring Colette in to kind of wrap us up, because I'm actually really excited. So we didn't talk about, I do a lot of work even globally in the conversations that are taking place at the UN. It was great to return to the Congressional Black Caucus annual legislative conference this year, where I ran into one of the advocates who really worked to ensure that the U.S. Department of Agriculture, launched and developed a depth of understanding about the importance of urban agriculture and the whole conversation around agricultural innovation. We've seen in news and headlines about Black farmers. I mean, there's just so much that's happening in the realm of your work that my mother would have loved to see you develop um, before she passed away. But I want to invite you to also be thinking about or giving us some things that we can be thinking about, as it relates to local communities if you have seen them that are successfully integration. There's also an interesting nexus between tradition, right?
Yeah.
The communities that we live in, represent, and we're born from, and innovation to improve food sustainability and health outcomes. So I don't know if there's something there that you want to tie in with the policy, if there are things that you're seeing relative to advancements in digital technology as well that might be helping to transform some of the practices and address issues like global food security and vulnerable communities. But there's just so much richness there, and I'm just so thrilled to have you weave that into the conversation. So let's hear some final thoughts from you about all of this and what we can do and what we should be looking out for.
Sure. Well, I want to go really broad first, which is to invite us back to the land. I want us all to consider, yes, we come from an ancestry that is rooted in slavery, but that's not where we started. And so even though we have the difficult stigma of agriculture within our bodies, this is a real thing. It is though that we can also address that through addressing it directly. I want to come in a little bit more around us considering to do more of these types of conversations, have more content where we are able to talk and collaborate with each other, because Dr. Webb touched on something really important around the funding of our organizations. And I'm not sure if those of us who are listening are aware that only 2% of all the funding from the NGOs gets to any female Black NGOs. Female-led Black NGOs get less than 2% of the funds available. So us supporting each other and having collaborative conversations such as these are extremely important to us moving that needle forward. But I then want to get really specific and say something like pickle juice. Pickle juice, particularly to Yasmin, who talked about PCOS, because we have natural cures within our food that can really address some of the challenges we're seeing with our hormones. So balancing our hormones with things like teas. So for example, we're talking about mental health. And for my mental health, I drink Tulsi tea. I drink valerian tea. I make sure that I get from organic source so that I'm able to manage my anxiety by making sure that I support myself, because I understand that these things make a difference. We can find other things that can help us with balancing our hormones, like nettle tea or licorice. And for women specifically, red raspberry leaf tea is one of those things that really assists us when we're going through our periods in managing through the pain of that. So, but pickle juice takes away all the pain. And it sounds like a weird thing, but I promise you it works. I know many of us struggle with all types of challenges that we deal with, but I implore you to consider the thing that stopped me from really from paying attention and pay deep attention and discipline for myself was that I learned somewhere, I read it, and it said the way that you take care of yourself is how you treat God, right? And I know that all of us come from a place where we are rooted spiritually. So I'm asking you to consider yourself first in how you take care of yourself. And that the number one thing that you can do to change the outcome for yourself is to feed yourself well. So if we look from that place and then consider ourselves in the larger picture as umbrellas, instead of looking at just the forest or the trees, that we look at both and see how we might be able to collaborate, but also think of ourselves individually and as communities. How can we get more healthy? So that's where I'd like to leave it, in considering how you might want to assist with this mission forward by getting back to the land, but also by taking good care of yourself.
Taking good care of yourself, and that starts with education and understanding. And I cannot say thank you enough to these incredible champions, panelists, organizers, advocates, all of you who have joined us in this vital conversation today. Thank you to those on the various platforms who have weighed in with comments, resources. Continue to share them in the chat before we close the room. If you want to share about some of the work that you're doing, please drop in your website, hashtags, resources. I know for me personally, who's worked on both sides of the aisle as an advocate and then also in government, your voices matter so much. I mean, it's so important for you to get out that vote, but then also on the other side to follow up. And that's why we wanted to end the conversation where we started with Dr. Webb around what we need to be kind of talking about and addressing, and also holding our elected leaders accountable, because they really do in so many ways set the bar and set the standard. And every time a baby's born, I like to, now that I've become a mother, my work for 20 years as a youth advocate, has taken a different frame now. Now as a mom of a toddler, every single day I'm looking into the eyes of the future, and a lot of these issues are not somewhere over there. It's like she's staring at me. She has a name, right? And it has just changed everything. So if someone has a baby, it's like I give them the fourth trimester book and deck of cards, because that's easy to comprehend and digest. And hopefully we'll see more resources like that as Yannick's work develops. That'll be directly geared towards moms of color. But that's cool because it talks about roles that the dads can play in different cultures, and important through the first 40 days. And it even provides things like nourishing recipes for those who are just looking for a place to start as a deck of cards. And, of course, I'm getting them the baby life membership to organizations like the NAACP, who through the resolutions process, it's been so nice to see how our advocates across the country are speaking up and speaking out and helping shed light on these issues through the resolutions process, which informs policy there as well. So just again, thank you for your insights and for your expertise, which have shed light not only on the challenges that we face in this broad spectrum of maternal health and reproductive justice, but also empowered us, with actionable steps to create meaningful change. And so whether you're on the call and you do not have children, or you're a dad, or, you haven't had children yet, etc., I hope that there was something here that you took, that you can learn, that you can share. Please do share using the hashtag and let folks know that you spent your Sunday evening with us, that you had this conversation with us, and what you learned and what resources you want to promote. Also, going back to maternal health, particularly for women of color, those in underserved communities, we are with you. This remains an urgent public health issue. We've got future leaders like Yasmin who are going to dedicate their lives to continuing to address and ensure that this issue, which demands our attention at every level, local, state, national, international, now more than ever, we're here as advocates to advance reforms and policies and programs that address the disparities, promote equitable care, and ensure that every mother everywhere has access to the support in the healthcare, including mental health care, that she deserves. Now, we did not aim to get into it all today. I'm going to bring Dr. Green back up to the stage, because the good news is there's more of these conversations that are coming, and you have an opportunity to be a part of them. But in the meantime, go ahead. Remember, number one, advocate locally. Reach out to your local health departments and policymakers to ask them how you can support maternal health initiatives in your specific communities, where you live, where you work, where you go to school, where you worship. All of these places are areas that are ripe for your advocacy and implementation. Even if it's just creating, we're seeing in the airports and some of the spaces at the UN now, quiet places for moms to pump, things like that. You can start with right where you are, right? It doesn't have to be coming down from the White House to do that. State and national and international, there's organizations like Black Mom Society, Black Moms Matters Alliance, etc., who are advocating, and they're in those spaces. So if you feel called to that, or if you have a story to tell and you want to share, stories are always needed and necessary to help provide resources and inform campaigns and advocacy tools to help lobby for the maternal health policies that promote equity and access to the quality care like we're talking about. But whatever you do, and as we conclude, we are asking you to engage in the political process. It's not about partisanship, it's about process and policy. And so as we are approaching these upcoming elections, make sure you're informed about where the candidates stand on maternal health issues, such as the ones that we've just barely gotten into tonight. Your voice is a powerful tool for supporting leaders who are committed to improving the types of policies that we're recommending that you take a look at and advocate for. And so engaging in that process by attending town halls like this one, asking candidates about their plans to address maternal health disparities, encouraging others in your community, text people, post to vote for maternal health champions. All of that matters. So please stay involved, keep learning, and remain steadfast in your advocacy and your support of Black Mom Society. Whether you're supporting local initiatives or volunteering with organizations like this one or using your voice in the political arena. Some of y'all need to run for office. I'm just going to put that out there, and there's organizations that can help you do that too. But every action you take contributes to a healthier and more just future for all mothers. So again, I want to say thank you so much, Dr. Green, for having us here today. And now let us know what you need us to do. And for everyone else, we'll see you online and we'll see you on the front lines.
Wow, thank you so much, Zephanie, Dr. Webb, Yasmin, Colette, and Yannick for this incredible conversation that we needed on women's healthcare, maternal healthcare. There was a comment in the chat via Zoom that asked about any food recipes that are available to moms, especially expectant moms, and also any products that you all can share as well. I know Yasmin had some that she was speaking to. Yannick was speaking to some of the accommodations that can be noted. There was Zephanie and Dr. Webb were speaking to some of the accommodations that are happening within some of the public spaces. What are some? Can the listeners? Oh yes. So.
Some of that is in that book, the fourth trimester, which is geared specifically towards that. And I'm sure there are others as well. Some of us can't drop it in the chat because we have to log into YouTube, but we'll find a way to communicate that with you.
I think I'm not okay. So at this time, we are so thankful for everyone to be on this call. We definitely would like everyone, and hold on a minute. Ms. Jackson would like to come. I'm going to ask her to unmute. Once she has a comment she would like to share. Are you off mute? Okay. Are you on? Can you hear us?
Yes, can you hear me?
Yes, we can.
Okay. Well, if there's any noise in my background, it's my two kids. Okay. So I'm a mom of two, expecting a third. On this time around, it's a third boy, unfortunately. Again, too much testosterone in this house. But the product that I wanted to share is, well, wait, let me backtrack. First and foremost, thank you to Yannick posting this. That's my mentor, my big sis. I knew her since I was expecting my first kiddo. She's been my mentor since Zion's going to be 11. So 11 years now I've known her. So I thank her for posting this. This was a great conversation. The product that I would like to share is for moms that likes to travel light. Anxiety was spoken up in this chat. And I don't know about any other moms, but I know from my first kid, traveling with so much stuff gave me anxiety because I'm like, am I going to lose my items? These are good items that was given to me. I like to take care of my stuff. So I developed the diaper wallet so you could travel light when it comes to quick errands, along with my new design, which is a diaper fanny. So you allow you to change your baby and carry your items all in one. So you don't have to worry about taking things apart and leaving things outside of your bag. Everything is just, you lay the baby out and you can change the baby on the fanny pack as well. But yeah, so stay tuned for those things. I'll share with Yannick and maybe she can share with you guys.
Thank you, Kira. We actually, if you have it, you can drop it in the in the chat so that we can see it and everyone can gain access to it. This is what it's all about, us sharing as moms, growing and creating access for us, because that is something that I needed when I'm traveling with my lovely toddler. So I think that that's something that we definitely need, especially because fanny packs are coming in style. Now more than ever, I've seen a lot of that, you know, around in different forms. But I think you should definitely drop that in the chat and let us know where we can get that and how we can support. And I just want to thank everyone for being here. This is what we need. I hope we all were able to gain some information so that we can absolutely bring this to our local elections, to the candidates, to the constituents, to the people that we need to make accountable, and even to our networks, right? Like, we need to be informed. We need to have informed decisions, factual information, topics and rhetoric that will make sure that we are continuing to drive the conversation forward. This is what we need as a community, as Black women, as women of color, women in this diaspora. We need to make sure that we are consistently and constantly making sure that we have factual information. And for this, I definitely thank you. We will definitely have more topics moving forward within the next couple of days, actually. And we want to keep this conversation going. So this stream is being recorded, thankfully, so that we can continue to have this conversation. We can have comments. We can actually have a part 2 of this, because this conversation is not just for this current election cycle. We need to continue to have this post-election in March, in May, in June. So we need to definitely have this no matter what. And I thank everyone for this. This was definitely a labor of love, and it continues to be a labor of love for Black Mom Society, because that's what we're here for empowering women. And we want to, if all hearts and minds are clear, we can end at this moment. I know we just have some more products. Kira, were you able to drop that in the yes, in the chat? Oh, you put in your IG. Perfect. Okay, so for everyone that wants to make sure that they get the products, make sure that you are able to follow Kira for her products. I was able to put in everyone's social media handles. Please make sure that you subscribe to Black Mom Society, and that you also follow the lovely women that were on this panel as well, so that you can continue to be engaged and connected with their work. They have some more work coming in. Colette is coming up with the recipe book, I guess 2025. Here we go. Miss Williams Adeniji will soon to be Dr. Adeniji. So we are this is happening. You don't have a choice. Yasmin Latchman, we are so thankful for you, because we need you to be the next OBGYN and continue the work that you're doing with reproductive justice. And Stephanie, thank you.
Thank you.
This was amazing.
You're amazing.
Yes. And Dr. Webb, we want to thank you for always being here with the knowledge that we need within medical practice. As Yasmin has said, it is not every day that you meet a Caribbean medical doctor and physician that actually genuinely cares about her patients and cares about the work that you're doing. And we will see Dr. Webb again in another panel, because she Healthy Kinder International is actually adjacent to the work that she spoke about today. So I think that it's definitely her voice translates into different spaces, and
I think that as millennials and Gen Zers and Gen Xers on this call and this panel and this conversation, that it's great to see that she's able to expand and move into different spaces and show that you not only have to be just a medical doctor in that space, you can move into different, you can move and shake into different industries and really advocate within that in the STEAM, as Zephanie alluded to before. And Zephanie, we thank you. She has changed her bubble, I think, a couple of times now. She was an entrepreneur, an educator, an advocate, not in the ACP Foundation. So we are thankful for the multiple hats that you've shown us today, and you've been a guide within this. And we will see everyone again soon. Thank you and take care.
Aloha, and thank you so much. Masterful technology.
Zephanie, it was such a pleasure to work with, as all of the other ladies. Thank you so much for having me. Dr. Green, this is wonderful. More love to you and every blessing.
Thank you.
Let's go change the world. VP needs our help. She's making this, she's bringing it to the global and national conversation. So,
Yes.
I think, it starts with the work that you're doing. So, and it stops there too, right? It all comes back full circle. So thank you all. I'm so inspired. My heart is so full. Mahalo nui loa.
Thank you.
Thank you all so much.
Thank you.
Dr. Green, when